And I know you're all survivors, or we use the word thrivers, but what are you doing for follow-up? I mean, we talked about it's not one and done with regards to surgery, and definitely with a diagnosis like this and this, huge, very acute phase of your treatment now has passed. It's behind you, thank God. What are we doing now? Are you still seeing your doctors regularly? Is there any imaging, blood test? I want to start with you, Ashley. We'll work our way around again.
Yeah, so I guess I'll answer that in a couple of ways. I am now 45. Thankfully, I made it 2 weeks ago, so really grateful for that. And I have, although I'm healthy and I'm active and I'm training for my first ultra marathon, I have a list of diagnoses like a mile long. And so a couple of things, having had ER/PR positive breast cancer, I made a decision for myself. It may not be the one that other people make, but I agreed to be on tamoxifen for 5 years to the day, and I promptly took myself off. Unfortunately, later, I developed a pretty severe pain in my right armpit, which felt really reminiscent of what the pain had felt like when I was originally diagnosed. And I had moved from the mountains outside of Denver to a small town in Southwest Colorado. And so I was away from my team. And at that point, I was trying to, navigate insurance, who didn't want to pay for me to go to Denver. And I had a really hard time getting anyone to take me seriously. And simultaneously, my hormones were going awry. And so I was still in my, just, I think 41, so still quite young. I have a naturopath that I see, so we're sort of managing things from that standpoint, but it took me having my appendix out amidst COVID and the end of June of 2020 to meet a surgeon who finally agreed that he felt a lump in my right armpit and removed a marble-sized lump of breast tissue from my armpit 3 weeks later. So I had a really bizarre reaction. Thankfully, my biopsy was negative, but I have this sort of sense that it either was or was going to be cancer. And so super thankful it came out. But with that, and also having textured silicone implants, I pay really close attention. So I actually make the trek to Denver to see my plastic surgeon because I do trust him implicitly. Get ultrasounds to make sure that my implants are still looking good, monitor. He has asked me to do regular self-exams and do so in the shower, actually, with body wash or soap or whatever, because it makes it easier to feel. So I will continue to see him. I see my naturopath. And sadly, I have a list of other things. So I have a very long medical team, but really stay on top of it because I was young and there's so much cancer in my family that I really just can't afford not to stay on top of it and be vigilant about making sure everything looks and feels good. And when I say look, I mean from a not an aesthetic standpoint, but health standpoint. So yeah, doing everything I can to
that's
stay
all
healthy.
You can do. I think that most people would advocate, a lot of these breast cancer centers. I know MD Anderson and Memorial Sloan Kettering have survivor clinics. So after, your diagnosis and your treatment, and it's all behind you, they still see you biannually and then annually, really for up to 10 years. I think that's important. And as far as implant maintenance too, just not to brush over that, but just with screening, regular stuff, feel your breast, ultrasound if something is abnormal after a mastectomy. I know some centers here, if you have retained the nipple, they're even recommending post-mastectomy mammograms to see that 2% rim of breast tissue Katrina that might still be there. And then with implants, it's just an MRI 2 years after placement and every year thereafter, just to look for a rupture, or what we call a silent rupture. And it's not dangerous if they rupture. A lot of these newer implants are more cohesive. They kind of stay put, but you want to know. And MRI seems the best way just to track a device. We'll go around, I guess, this way. Lauren, what kind of surveillance are you doing these days?
So which surprised me, I still have to see my oncology surgeon, who I love, every 6 months. And she said at some point in time in the first 2 years, there's consideration or talk of doing a baseline mammogram, which I'm not thrilled about, but I'll do if that's what she wants me to do. She said there's no hard, fast guidelines. It's made up in different communities, and I'm okay with whatever. I trust her completely. If that's what she wants me to do, I'll do it. And I told her I would. And I think she was just kind of warning me at the last visit that maybe that's going to come down the way. So I have until, I think, October 23 to get that baseline done, which is fine. And then I see my oncologist right now. I'm seeing her every 3 months because I had a lot of problems tolerating anti-estrogens with arthritis. And so that was another little aftermath thing that you don't think about after you're done with. You're like, ooh, I'm past surgery. Ooh, I'm cancer free. Oh, this is so great. And sure, I'll take that pill. And then you don't really realize what anti-estrogens are like on your body. There are some side effects and sometimes they're intolerable. So I had some issues with that sent me to rheumatology. And, but everything's going very, very well. They're all good problems.
You're still here, girl. You're still kicking. I'll take
You're
it.
stuck with me.
I'll take it. How about you, Katrina? What kind of follow-up are you doing still?
Yeah, so I'm, let's see, I'm 6 years out from my most recent diagnosis. I am seeing my oncologist every 6 months. In the past year and a half, I moved from Chicagoland down to San Antonio, where I'm from. And so it's been tough just because I had a team who I literally could text or call anytime. And actually my OB-GYN who delivered both of my kids has really kind of stayed constant for me. I'll go up, she'll run my labs. Because I haven't had like a team here that was doing all the same things that I was having done in Chicago. So again, I've had to really advocate for myself and make sure that I'm asking for certain things. And some academic medical centers they don't do tumor markers and they don't draw everybody does it a little bit differently. But there was that made me feel a little comfortable, like to get those tumor markers, even if there are false positive or, false negatives. I still was used to a certain protocol and that has changed. So that's been a little bit challenging. But I do an MRI every year. And I, that looking for rupture or any other evidence of any disease. I don't do any mammograms. I haven't for many years, actually, after my first set of implants were put in. But I think, importantly with my BRCA1 mutation, not only is that, potentially breast cancer, as it was in my case, it's also ovarian. So I've had a full hysterectomy in 2016. And then the other component is melanoma. So I mentioned I've had 2 of those. So I see my dermatologists every 3 months for regular skin exams, and they've taken a lot off. But now we're at a point where it's severely atypical only, and others, they just kind of watch and do skin mapping and all of that. So
but you're looking, and I think that's key. Well, you guys are remarkable. That kind of wraps up our roundtable. Ashley, Katrina, Lauren, your stories are different. Your stories are your own, they're very personal. And I really thank you all for sharing that. I mean, it's touching, but, you are really strong, powerful women. You are your own advocates. And I think, you know yourself best. If something's not right, or you don't feel comfortable or don't have the best team, find it. It's out there. Everyone's journey is their own. And the most important thing is to have you all here in 20 years. So, but we're not going to age at all. We're just going to be older chronologically. But thank you. And, really follow us on Brave for more information. I think Brave's probably one. I think actually it even lists on the site some other resources just to get really objective information on breast cancer and breast restoration. But thanks for tuning in.
Thank you.
Thank you.
Thank you.